They say no one is ever really taught how to have a happy marriage, but our guest today has spent his entire career trying to change that. From neurofeedback and brain mapping to intensive marriage retreats, he has helped over 200 couples bounce back from the edge of divorce. His work blends cutting edge psychology with deeply practical tools to bring back peace and passion into relationships. Please welcome licensed psychologist Dr. David Helfand.
Thank you, AJ. I think that was the most enthusiastic intro I've ever heard for me, and boy, it's great. I love the energy already.
Oh, thank you. My pleasure. I always want to make sure my guests get the due credit and due attention that they deserve.
Yeah,
So
maybe
it's my
we'll have
pleasure.
some fireworks in the background.
That would be awesome. So, what is neurofeedback? I wanted to start from there.
Sure. So I started my career in neurofeedback, and the way that I like to explain it is that it's basically physical therapy for your brain. So, if you hurt your leg, you go to the doctor, they help you stretch it, strengthen it, work on flexibility, right? When it comes to brain function, we don't have an easy way for people to understand what's going on in there without using some kind of technological aid. So with neurofeedback, you can put an electrode on your head and actually see, well, what's the function of this area? Does it need to speed up? Does it need to slow down? So if I tell you to slow down the alpha in the back of your brain, you're like, oh, okay, how? So having feedback is actually makes that accessible.
Fascinating. So, when this is going on, is it more like the guests do some kind of action and then get an immediate kind of electric pulse, something to give feedback whether they're in the right direction?
Yeah, sure. So neurofeedback is used to contain a lot of different treatment modalities.
Got it.
And so, if you're going to look up neurofeedback, it's a little bit like Googling chocolate cake. You're going to get 1,000 different recipes, right? So,
Yeah.
so there's different styles, and there's some research that suggests one style might be more beneficial over another in certain circumstances. And so I think if you're going to go down that route, it helps to know what you're looking for and be educated. In a general sense, when I use neurofeedback, I'm talking about a more classical definition, which is a operant conditioning and learning paradigm, where if your brain is in the desired state we're looking for based on whatever your defined goals are, you get some kind of positive feedback. And if you drift away from that, the feedback stops. So in practice, a session might look like you're watching a video, maybe there's a streaming service connected. When your brain is in the desired state, you're more calm, more attentive, however we're defining the goal there, the screen would become bright. And if you're outside of the parameters where you're heading towards your goal, then it would become dimmed or slightly opaque or fuzzy, so that you have to change your brain to get back to the desired state.
Okay, that's really fascinating. I'll come back to this for a little bit, but I wanted to ask you a question that I found online, right? So the title was, why does my husband cry since he started cheating on me? Okay, and that's the question. I know it's really difficult to respond to these in a generic sense. So when you listen to this, what I would be really curious about is what questions would you probe the writer to think about? I think that would be easier to go forward with than giving generic advice.
Yeah. Well,
there's more to the post. Would you like to listen to all of it, or would you like to?
Actually, I think I have an answer. I think this is one
that's
that I can
awesome.
answer directly.
Yeah, please
So
go ahead.
the research shows that people that have affairs are going outside the marriage for what they're not getting in the marriage.
Correct. Yeah.
And it also suggests that people have attempted to achieve their needs within the marriage, but they've been unsuccessful in doing so for a period of time.
Got it.
So the reason that a husband might be crying, even though he's the one that went outside the marriage, is he didn't want to. And now he's left with the shame and the guilt for having a need that was met feeling good about having met a need, because it feels good to have our needs met. And then we're talking about emotional affair, sexual affair, a kink, whatever someone's interested in. So, I mean, there's this paradox of like, well, I feel good because my need was met. I also hurt my spouse and I'm a piece of crap now.
Yeah.
And I have this weird conflict going on because I feel all these mixed emotions.
Yeah. And I think this is the hardest part for a lot of people to gather, because they think that they're doing everything right, and then this other person just went and had an affair. What they struggle to grasp is that there's something missing in the marriage, that either your partner's not able to communicate to you properly, or like they've tried communicating and you're not able to receive it. And so they were forced to go outside to actually get those needs met to move forward. And I found like it's really hard for people to get that, because I've spoken to some people and it doesn't make sense to them. 'Cause it's like, I'm doing everything I can. Why is this not enough?
Yeah, the metaphor that I often give to couples is, imagine you are starving. And we actually know that the connections and community that we have as human beings is a better predictor of longevity than our nutrition, than our substance abuse, or than almost anything, than our weight, almost anything. So if you are deprived of some kind of connection you're looking for, again, sexual or otherwise, if you are starving and somebody says, do you want a bite of this burger? It's going to be really hard to say no.
Yeah.
And so when you understand it from a survivalistic perspective, sometimes it makes a little more sense. It still feels shitty though. Like all the metaphors and all the logic behind this don't take away that, like, it's just a really hard experience to go through.
Yeah, yeah. It's sad, but it's so true. And I recently, while I was working with couples, I learned how true it is that people get attracted to what they need outside. We were talking about neurofeedback, and what I'm curious about is, were your parents also working in this field, or was it something you picked up by yourself? Because I know your parents were couples therapists too, correct?
Yes, that's correct. So my dad has a history of training in hypnosis, some peripheral biofeedback, more like galvanic skin response and temperature and blood volume pulse and the classic peripheral measures. They never did any training in neurofeedback, but it was something that they had some awareness of earlier in their career. And actually, when I was in high school, I had a theory that if you could treat the brain in a targeted fashion, you could probably get rid of all human suffering. Because, I mean, of course, what high schooler doesn't have a grandiose idea of how they can, impact the world, maybe. Yeah. And so at some point, one of the clients of my parents, I guess, had been doing neurofeedback sessions, and my dad said, "Have you ever heard of this?" And I said, "No, I never heard of this." And so then I started researching it, and in undergrad, I started doing some independent study in it, and continued on from there. Their practice was the last 30 years. They just retired, actually, but it was in couples retreats. That's been their primary business for about 30 years.
Okay, so they were also doing couples retreats. That's incredible.
Yeah, and then they, like I said, they retired, and I just took over their whole practice 6 months ago.
Oh, wow. Did you ever have disagreements with your parents on how you should work with a couple? So, from a theoretical standpoint.
Yeah, absolutely. So, as you can imagine, as I started to work with couples and start to enjoy the retreat work, basically I just took their whole curriculum with their blessing and modified it and updated it with the neuroscience that I believe in.
Right.
And also just more to my style of therapy too, which largely overlaps with theirs, but there are some differences. And there are times where I would consult with them to say, hey, several years ago when I would have a client with a specific medical condition that I had never really worked with, I would run it by them to say, are there considerations that I should know about for a male who has their prostate removed and now they're interested in sex therapy, as an example. And, they've seen almost everything. So, they had some thoughts. As I've gotten more training and more experience, we can definitely debate a little bit more with some acumen behind me, I would say.
Yeah, I mean that's what experience does, doesn't it? Has there been an experience in your journey working with couples that surprised you as a case, without revealing too much details, just whatever,
Yeah.
as vague as possible?
I mean, I think I generally don't consider myself highly emotional. I don't know that I'm stoic either, but I don't consider myself highly emotional. And so there are times in sessions where, the couple is having a very emotional experience and I'm there, being present, but, neutral and aware of the room. But there are times where people tell stories that are just, can I say, fucking awful? Like some of what people have been through is just blows my mind. And I remember a few clients, one in particular that I'm thinking of, where his childhood, I am blown away that he is alive, runs a business, and got married. I mean, he was struggling in his marriage, but like the fact that he even opened himself up to be vulnerable, and for your listeners that know the ACEs scores, I mean, he was a 10 out of 10. So ACEs is adverse childhood experiences, and I forget the exact number, but if you score like a 3 or 4 or higher, the chances of you having depression, divorce, suicidality, being obese, having heart problems, like all of these things go up based on your childhood experience. And he was a 10 out of 10. He just had a horrific childhood.
Wow, I cannot imagine what that must have been like.
No, and he's telling his story, and this is one of those times where, I mean, you can see the tissues in my office, but like I keep a box here every now and then, and well, I keep it there all the time. And I mean, I was reaching for tissues when he was sharing his story because it was just so awful.
Yeah, when you were sharing this, I remember this one situation. It was, I think he was a former army person who came to me and told me that he's really struggling with his divorce. And I heard his story, and I remember just like I tried to stay centered while I was in session with him as he was speaking to me. But once the session ended, I just needed time to feel so bad for what this person had gone through. And it is so tricky when you are working with these painful situations, because you have to be the one trying to guide these people. At the same time, you're human. Like when you hear these, your emotional part just jumps out, feeling for this other person. How do you balance that?
Well, one of my plans for my business is not just to help as many couples as possible, but to train couples in this model. And I firmly believe that as part of this training, to do this kind of intensive work, you have to have a good self-care regimen.
Right.
And so part of that is knowing your limits. I don't work full long days anymore. I work a couple long days because I can kind of cram it in, and that works for me. But then I work a few part-time days to then have the afternoons to myself and take care of myself. I signed up with a personal trainer within the last year because I needed that physical exertion because I'm sitting in this chair all day.
Yeah.
I do my own neurofeedback. I have a meditation practice, diet, all those kinds of things. I mean, the other thing personally for me is I have 2 young children. They're about 9 and 5. And boy, when kids have a good life, they are like the most resilient humans you will ever encounter. And so seeing how they go through life and watching their roller coaster at times is inspiring too.
I wasn't planning to ask this question, but you brought up kids, and it got me curious about something. To build resilient kids, right, as a parent, while ensuring they're not really spoiled, how do you keep that balance?
Spoiled is an interesting term, right? When we think of spoiled, what do you think of? So we think of, lavish gifts. We get them all the new was going to say Sega games, but that dates me a little bit, huh? All the new PS, whatever.
I know, I'm aware of Sega games, so I guess we're dated just as much.
Oh, good. So, you get them new phones every year when they're like 12 years old, right? I mean,
Right.
there's a level of spoiling that I think everyone kind of understands. This idea of spoiling your kids because you pick up the baby when it's crying and hug them is really odd to me.
Yeah, I get that. Yeah.
There's a level of developmental psychology, and there's some entrainment that happens from child to parent that I think people miss and they forget about. So a nervous system, when it's born, so a child's nervous system, it doesn't know how to do almost anything. It knows how to breathe. It knows how to process waste. It knows how to, keep the heartbeat going.
Yeah.
But and a couple other processes, but that's basically it. It doesn't really have a circadian rhythm yet. It doesn't know how to self-soothe. It doesn't know how to speak, how to walk, how to do all these things. And so there's some really good research that you have to expose children to that so they can then learn it. And one of the reasons that we all have mirror neurons and we all are, in tune with people around us, hang out with a friend who's really anxious and notice that your heart rate goes up after, an hour or something.
Yeah.
And the reason we all have that is we're trying to sync up with the people in our lives that we feel close to. And a baby's the same way. So, what I would say for parenting and spoiling your kid is model for them what you're looking for. If you want them to fall asleep and relax, take some deep breaths, hold them on your chest, and relax your nervous system. Yelling at your kids to stop yelling at their brother is really bizarre parenting behavior.
I get that, the hypocrisy in that situation. I think the frame of mind I was coming from was, I think some kids end up growing up to feel like, when they really need something, they have to get it immediately. They don't have that space or patience to wait, to work a little bit to try and get what they need. How do you build that skill into kids?
Well, I think that also comes back to modeling. I mean, think about if you're looking at your phone here and you're trying to, order something, and then you go, I can't believe it's going to take 2 days for this thing to arrive. Or, oh my God, it's going to take a week. Oh my God, right? Kids are soaking up everything and watching everything the parents do, and they're internalizing it. So, if you're impatient, they're going to be impatient.
Okay.
So I think one of the best, and I say this to couples too, one of the best ways to improve your relationship or to teach someone something is to model it and, to stop sabotaging your own achievement.
Wow, this is such a fascinating topic. So let's say a couple, one of them realizes, okay, the partner is going through something, okay? They're going through a really hard time. And let's say the partner we're speaking about is depressed. It's a really bad time. And the other one is doing okay, at least emotionally a little better. In order to influence this other partner, are you saying that we start improving and growing and then the other one automatically kind of tries to sync up and starts getting better? Does it work that way?
It depends on the context of the situation, right? So if your partner is mad at you and then you're like, well, life is good and I'm a Buddha, they're probably going to get more pissed off, I would think, right?
Yeah.
So, I mean, there's some context that matters here.
Yeah, makes sense.
Generally speaking, though, human connection is one of the best ways to regulate. So, for people that want a paradigm here, are you familiar with Mark Brackett's work? Has that come up in any of your previous podcasts? So, really good researcher. I highly recommend his book, Permission to Feel. He's the director of the Center for Emotional Intelligence at Yale University. He has an app. He has a second book that just came out a month ago, actually. Really, really cool guy. And I have no investment in his company. He's just a really good guy. So the reason I'm bringing this up is that he has a grid called the mood meter.
Okay.
which talks about a layout of emotion that's organized on a two-axial system, high-low pleasantness and high-low energy. And there's this misperception in our culture that when someone is a really unpleasant emotional state, that we want to bring them over to the other side. You know, someone who is enraged, we want to say, no, life is good, be happy, think about what you have, right? Don't let this get you down. Someone who's depressed, oh, you have so much to live for, right? All these kinds of things. What we're actually subconsciously, in a sense, trying to do is to bring someone from one extreme to another. Someone who is despondent to being euphoric. Someone who is enraged to being exuberant. And if you actually went from those two categories, we have a word for that. It's called psychotic. Imagine someone going from those extremes, right? But, I mean, we could talk so long about this. In our culture, there's this sense of like, if the people around us aren't happy, we often take that personal. You know, think about hanging out with a friend who just had a tough day and you're like, well, why can't you be happy when we hang out? Like, we take it personal, which is really bizarre. So getting back to your question, connection is one of the best ways to neutralize the energy and encourage someone to find a more balanced homeostasis. And for the health psych people out there, I would actually call it allostatic, not homeostatic. And that's a very technical distinction there, but anyways, homeostatic state. And that's because when people are really out of it, so if you get into a fight with your partner, if they're upset with their boss and then they come home and they had a tough day, right? Part of what's going on the underside of all that, on the undercurrent, is that they have felt disconnected from any sense of humanity and people. You know, the world is against me. My job, my office doesn't understand me. It could be your kids, right? The kids are driving me crazy. They don't understand that I'm doing my best and I'm sorry I yelled at them, right? So if you as the partner can come in and provide that connection, it is so powerful. And a lot of what I talk about with couples is that the couples that can turn stress into intimacy have a gold mine, because stress is a given variable in our lives. And if you can recycle that to connection, it's so powerful.
Stress into intimacy. What skills do they need to be able to do that?
Sign up for a couples retreat.
Of course.
But in all seriousness, though, there's so many different skills to use. But I'll give just a couple examples, or maybe one. We'll see where we go.
Yeah.
So the Gottmans, very well respected in general in the field of couples therapy. They have a very well vetted paradigm of a 5-to-1 ratio. For every one negative interaction, you need 5 positive interactions with your partner. And this has been well vetted for the most part. And there's a lot of science behind why that is, if you want to go into that at all. But generally speaking, 5-to-1. I like to take it a little bit of a step further. Because yes, teaching couples to have 5 positive interactions is fantastic. And if you can have more positive interactions, great. But it also means that a negative or unpleasant emotional experience has 5 times the potential energy behind it as a positive.
Yeah.
And so if you think of this as a nuclear energy, because it's really quite powerful then, you can do 2 things. You can use that energy to create bombs, which a lot of couples do. They just drop bombs all day on each other.
Yeah.
Or you can have a nuclear facility where it powers your relationship.
Wow. Love the metaphor.
Thank you. Yes, that came to me in a session like 2 years ago, and I went, "Oh my God, I'm writing that one down."
yeah, that's really cool.
So the idea here is, again, let's say you come home, the kids are driving you crazy, and your partner walks in the door from work because you've been with the kids, and you're just going, "Oh my God, these effing little people in my home! Like, I can't believe." There's toys flying, there's a mess in the kitchen, like it's just been crazy.
Yeah.
And if your partner comes in the door and judges you, or like, "Hey, how come dinner's not ready?" Or, "Well, wait till you hear the day I had," and it starts to be like this competition, that's just going to set it back even further, right?
Right.
But if they can come in and go, "Sounds like those little hellions gave you a run for your money today." If you can connect around the stress And if there's an opportunity to say, you know what, hon, I was in the same place yesterday when it was my day. Yeah, it is tough being the solo parent, even for an hour or two, let
Yeah.
alone 6 hours or whatever. If there's empathy and there's connection and genuineness,
Yeah.
you've taken a stressful experience where all those hormones are heightened and you've given them an off ramp. And you're the one then that your partner is attaching to as the solution to that.
Absolutely. I love this example. And even in my coaching practices, what I've generally found is that when people's pain feels acknowledged, the level of openness it creates is not even fathomable. I was just speaking to a client a few days ago, and they were going through, oh, this is happening, that is happening, and I kept trying to dissect what's happening. And at the end, when I was able to rephrase exactly what she was going through, she was like, yes, yes, you get it. And as humans, we are all craving someone understands what we are going through. And I totally get what you're talking about. Instead of judgment, if you can try and understand what this other person is going through, even though it may be tough, you've come back from a long day, you've come back from whatever painful situation, if you can go that extra mile, it'll come back to you maybe 10 times.
It is. And I think the fallacy that I often see with couples is there's this unspoken attempt to make it simultaneous. And what I like to point out to couples is that in order for someone to be heard, there has to be a listener. And if you are both trying to be the speaker, there is no listener and no one will be heard.
Yes. One of you has to be the listener. My wife and I have this phrase. We call it, one of us has to hold the fort. We hold the fort while the other person is letting it go, being vulnerable, seeking your, leaning on you. And it's your role. Just stay with them, hold them through it. And when you want to do the same, they reciprocate. And you found it to be super useful.
I 100% agree. I think it's important to know that that looks different for different people too,
Yes,
right?
yeah.
Like if my wife has a bad day, the default is she wants a hug, she wants to talk about it, and then if I can make her a cup of tea, that's like the extra credit, you know? And she sits with her tea and she's good. If I've had a bad day, I don't want to be touched, I don't want to be talked to. Like I need 10 feet of space all around me, no sound, quiet. Like I need my own space to just process it, and then I can move on. And you can bet that we've made mistakes thinking that what I want is what you want early in our marriage. But you know, we had the conversation and we figured it out, and now we know how to navigate that.
Can anyone learn neurofeedback and do it on themselves? What I mean is, can the average person take a mini course and then try to do neurofeedback on themselves? Because I remember you mentioning that to take care of yourself, sometimes you go through certain neurofeedback sessions.
So yes and no. You know, you can go into Home Depot and buy any tool. Doesn't mean you know how to use it. Doesn't mean you'd be safe using it.
Yeah.
However, if you go in and buy a saw because you want to cut shelves for your house, you could pretty quickly figure out how to cut a shelf and how to use proper safety and all that, and that's pretty straightforward.
Yeah.
If you want to go and create a banister system and a guardrail in your second floor, you probably want a little bit more training because the risk is amplified, right?
Yeah.
So I would say the same is true with neurofeedback. That if you have a history of epilepsy, if you've had a TBI, a concussion, if you are severely depressed, if you have trauma, you know, these are kinds of red flags where you're going to want someone more professional overseeing your treatment.
Got it.
Whereas, you know, you can go buy like a Muse and do a training on your prefrontal cortex, and it's a one-size-fits-all protocol. There's some benefit to it from what I've seen. People can learn how to relax, but there's some indication that if you have a more complex need, you want to be cautious.
Got it. Okay, that's the question came to me to understand basically how complicated it is, because if everyone can try to access it, That was the perspective.
Yeah, well, I mean, I'm happy to give you. You can put resources and links in the footer notes if you like. But isnr.org, bcia.org. These are international organizations that have directories of providers that at least have minimal experiences met and are part of a community where people are talking about protocols and research. And so, in general, I would look to that. One of the issues with neurofeedback is that it's not a very well regulated field. So even someone with a high school diploma could find access to a system and set themselves up to then start using neurofeedback. And, if you're just trying to teach someone how to relax, or, if you're looking at peak performance with athletes and trying to give flexibility in their brain, you could make a case that you don't need a ton of training with that. Although now that I'm saying that out loud, a lot of athletes have concussions and you might want to get some extra training then.
I get that. I wanted to step into to understand your marriage retreats a bit. So how long do these retreats run and what can people expect from it?
So I generally find that a 3 or 4 day program is optimal for couples. What I usually say is 2 days is for marriage enhancement if you don't have any issues. 3 days is for couples in crisis, including discernment counseling. And 4 days is for crisis plus trauma. So if I need time to untangle childhood traumas and early stressors and baggage, as it impacts your marriage, then having an extra day to weave it all together is usually helpful. And the idea is that when I work with couples, your marriage or your relationship is my client.
Right.
And so I usually start with the same hypothesis. Every couple can have the marriage they've always dreamed of. They've just never been taught the skills to make that possible. And so I like to spend the first few days of the retreat working on the relationship, working on the marriage, if both spouses are open to that. And the last day of the program then is the decision point. So now that you've gone through this process and you know what goes into having a happy marriage, do you feel like you're heading in the right direction and you could in fact be part of that group? And if yes, we continue on. If no, then we usually talk about a trial separation and all that entails, and I help negotiate some of the particulars in that space. And I will say that I am hoping to be publishing an article in one of the scientific journals on marriage. I'm very excited about this. So I have about a year of data over about 30 couples.
Wow.
And so far we see the success rate is about 88%. About 88% of couples coming in for discernment in crisis feel hopeful enough and that they've made enough progress in 3 or 4 days that they can continue with their marriage and keep working at finding happiness.
That's amazing. And do you do any follow-ups after the retreat is over, maybe 6 months, 12 months, anything of that form?
Yep. So in 3 to 6 months, I usually reach out to follow up and see how people are. I'm still collecting some of the longitudinal data. It appears that it's roughly the same that continue to hold the gains. We're about kind of 84% right now, but again, I still need to collect the rest of the data from these people.
Okay. Awesome. Actually, let me step back. I wanted to try and understand what goes into building a retreat like this. And when you create the program, or when you go about setting it up, I assume it's in cohorts of sorts. What do you focus on? What's the end goal that you're thinking about that these couples should go out with?
Well, they set the agenda. So
okay.
My format is to get you results. You're paying me to get you results. And so if you say you want to try to be happy and stay married, okay, so what needs to change in order for you to turn to your spouse and say, I am happy? Like, what would that actually concretely look like? What needs to change? And then we work on that. So if it's that you've been in a sexless marriage for 10 years and you want sexual intimacy, okay, so we need to work on sex. And that's part of the process, right? If it's, well, we argue every day, okay, if you had an affair, we need to heal from the affair. So it's whatever goes into the couple's goals so that they can feel like I'm getting what I need in these 3 or 4 days. And then as you can imagine, there's research on how you deal with affairs. There's research on sex therapy. So of course I'm bringing in the different modalities as needed.
Okay. And is it all, how many couples come to a retreat at once?
1.
Oh, it's individualized. It's focused on each. Okay. When I heard retreat, somehow the image my mind made up is it's like a group program where multiple couples come in and you help them through it.
Yeah, so there are group programs that other practices offer. Part of the group programming is to offer a lot of education and a lot of training. Yeah. And then, sometimes they bring couples on stage and do a piece of work. I have found that I like it better. I'm more rewarded. I enjoy it more. And I think couples get more out of having an online course that I send them so they can do the training before they ever get here and learn all the basic skills and background. Right. And then when we're together, we're dealing with their issues in a private closed door setting, because it's really hard to tell your spouse that you cheated on them. It's exponentially harder to get up in front of a group and say
yeah. That's what I was thinking. That's why I was like, if it's a group setting, I imagine that, it must be a lot of education and maybe there's some private aspects to it, but this clarifies it and it totally makes sense. In fact, when I was trying to decide between group and individual, and to me, it didn't make sense to have a group, especially if you want to deliver results to couples, because it's a very private, vulnerable space. So it makes sense that they should be in a very private space. How do they reach out to you? Is it you run ads, or it's usually word of mouth? How does it happen?
It's funny, when I worked with anxiety and depression and insomnia and panic disorder and all that, my practice was filled with word of mouth. And since I started working with couples, everyone keeps their relationship really secret, I find. There's not a lot of like, oh, your partner had an affair, you go see this person.
Right.
I do get word of mouth, but it feels like the secrecy around marriages is very different.
Yeah, it's a lot more. That's what I've noticed as well. And
yeah, it's really interesting. So to answer your question, it's a lot of talking about the common issues people face in blogs, in podcasts. People see a blog or a message or something, and then they end up on the website, they read through the curriculum and go, okay, this sounds like something that I would benefit from. Or they sign up for the newsletter to say, okay, I don't know that I'm in crisis yet, but I feel like there's some things that could improve in their marriage, and let me just get some free info. And that's great. If you want the free info, that's why it's there, go for it. And down the road, if you need help, then, we're here to help.
Can an individual, let's say they have no background in psychology. Trauma is such a generic word used right now. And I'm very sure a psychotherapist has a very different definition, different checklist to actually see if someone has trauma. So how can a person realistically assess if they've had trauma and they really need help at an extended scale? Can they do it by themselves, or best is just go to a therapist?
So there's a couple features I would say. One response would be that it doesn't really matter if you have the label of trauma or PTSD. What matters is the behaviors that are prevalent in your relationship. Right. And so, I don't typically go through the DSM and be like, okay, do you have PTSD? I'm more interested in how it's playing out. And I really like Peter Levine's definition of trauma. Trauma is not the event, it's the reaction of your nervous system. And so your trauma might be someone else's normal Saturday, right?
Yeah.
Especially if you grew up in a chaotic household, right? And so one of the ways to see if you have trauma, or if doing kind of trauma related work would be useful, is to really introspect on the arguments and the sensitivities and insecurities you have within the relationship. Because I like to talk about the 90-10 principle with couples, which is that 90% of the reason you have a strong emotion is historically rooted, and only 10% is contemporary. So if you're having a conversation and your partner, rolls their eyes at you and you just get enraged, it's probably not because they rolled their eyes. Rolling their eyes is, maybe it's kind of a rude thing to do, but it's fairly mild, right? But then if you realize like, wow, I just felt dismissed, I felt belittled, I felt rejected, I felt unloved, unheard, that's probably coming from something deeper. Right. And so then whether you call it trauma work, whether you call it intrapsychic psychological treatment, whatever you want to frame it as, doing that work would be beneficial.
Yeah. I get that. And I think a lot of people I find today want to jump to the conclusion that they've had trauma. And I don't know if you agree with this. This is just my hypothesis. It feels like a lot of people have the need to feel like a victim. And so the word trauma really helps them get there. How do you find this hypothesis? Am I quite far off, around the ballpark? What's your...
This has been really well studied when it comes to some of the isms. So alcoholism, sex addiction, sexaholic, that kind of stuff.
Yeah.
There's something about sometimes so the debate in the field is that having a label absolves you of responsibility, Well, of course I drank too much because I'm an alcoholic. Yeah. And then you have no agency. Some people argue that, well, no, now that you have the label, you know that you need to go to treatment and be careful around your alcohol use. And so I think it's a tool, and it depends on how it's used. I do think that there is a tendency for people to write off their own agency based on a label. Right. My father was I'm a child of an alcoholic, so of course I have trust issues. Well, you can work on that. Yeah. There's things we can do. So it's almost like they've made it a quarter of the way through the process, but then haven't continued past that.
I have a really interesting question for you. I have seen some people who do not even believe in the idea of therapy. And the challenge for a lot of people is, this is how life was. This is how life is. What's the point of going to a therapist? You just need to simplify it and just take it easy. How do you communicate the value of therapy to them?
I would ask, is it working for you? So if the way you approach your life works for you, I don't think you need therapy.
Okay.
But is it actually working for you? So it's like when I have couples where somebody says, we don't need therapy. And I say, okay, are you happy with your marriage? Well, I wish we had more sex, or I wish my partner wasn't that mad at me all the time. Okay, so it sounds like there's some things you'd want to work on.
Right.
That's the purpose of therapy. If you want to work on those things, that's why you would come. And if you don't, and life is good, okay, that's great. Good for you.
Yeah. Awesome. So I think now is a great time to switch into a game that I planned. And this will be more about you than relationships. So it's going to be fun. I'll just read out what the format of the game is. So it's just called Would You Rather? And it's going to be either or questions of what types of couples you would prefer to work with in your practice. Okay? So here's the first one. Would you rather work with a couple who says we never fight at all, or a couple who says we fight every single day?
My inclination is to go with the couple that fights every single day, because the research shows that indifference is actually a worse state than that emotional outburst.
Yeah, that's what my mind was also telling me. If they've gone to indifference, it means they've fought so much or they've gone through so much pain that they don't even care anymore. So it's a much further journey than someone who's still fighting every day.
Yep.
Would you rather help a couple that refuses to discuss money or a couple that refuses to discuss sex?
Money.
Why?
Because sex is so vital to the conversation that if you're refusing to discuss sex, it might not work. I mean, sexual intimacy is so important for many couples. Now, if they both say they don't want to have a sexual relationship, if they're asexual, then maybe there's a caveat there, but that's not the majority of couples.
Yeah, got it. Okay. I see what you're saying. Yeah. Would you rather work with partners who are total opposite in values but deeply attracted to each other, or partners who share every value but have no spark?
Couples that are opposites. So opposites actually attract. There's very real science behind that, and we can get into T cells and pheromones and biodiversity and all that, but it's very well founded. And if there's no spark, it's really hard to create a spark from no spark.
Right. Okay. Would you rather guide a couple where one partner overshares every detail of their feelings, or one where both partners refuse to open up at all?
That's an interesting one. So one partner overshares, and then the B option is that neither of them share anything.
Yeah.
I would say there's so much context there that I would want, but in general, if one partner is willing to share and the other partner is willing to listen for the majority of the time, there's a lot of work we could do there. If both people are clamming up, that might be more challenging.
Of course, like these questions are obviously generic. It cannot be individual case like someone goes and says, okay, this is ideal answer. It's a generalized question. It's just for some fun.
I understand.
Yeah. Would you rather work with a marriage that has zero intimacy but great friendship, or one that has great intimacy but constant fighting?
I've seen both of those many times. Boy, they're both really interesting. Can I pick both?
I mean, that's okay. That's okay. I'll let it go for this one.
Yeah, because there's just I've seen both of those cases so many times, and I think they have different strengths and weaknesses. There's something about helping couples work on their sex life that's really fulfilling. There's also something about couples where they have a great sex life, but then they're just constantly fighting with each other too, where there's like passion. So maybe I'm leaning a little bit more towards that one, but kind of both. Okay. So
would you rather...
Can I bring up one of my favorite TV show quotes here?
Yeah, go for it.
So this is a deep confession for your audience now, but one of my favorite shows was Dharma and Greg from the 90s.
Okay.
Just a fun show. And there's an episode and a scene in it where the hippie couple is fighting, and then the son-in-law walks in on them having sex in his kitchen. And he runs out and goes, oh my God. And he says, well, I'm glad at least the two of you aren't fighting anymore. And one of the spouses says, oh no, we're still angry with each other, but we're not going to punish our bodies for a fight our minds are having.
Oh, wow, that is so deep. That is so deep. Oh, wow. And really profound.
Yeah, I remember that clearly. It's a great episode.
Yeah, wow. That's a really profound sentence. Would you rather help someone who says, I don't love my spouse anymore, or someone who says, I love them, but I can't live with them?
So the second version is a little further along in the process. So that might be a little easier to work with. I would be happy to work with either. The issue with the first one is that most people, when you really dig down, still love each other. They just don't like or lust each other anymore. And even couples that are getting divorced often love each other. They just don't like each other. So, it's probably easier to work with the second one, so I'll go for the easy answer.
Okay. What I have realized is a lot of people, as you said, they have the love. They really love each other. But it's almost like it's too painful to love this person. So I would rather tell myself I don't love them anymore.
Yeah, or people have different definitions of love. Love is that I want to spend all my time with you. Well, it's not really love. The definition of love that I really like is unconditionally wanting the best for that person.
Okay. Yeah, that makes sense. Would you rather help a couple who can't agree on how to parent their kids or one who can't agree on how to spend their money?
Oh, that's not the direction I thought you were going. So, wait, say that one again then?
Would you rather help a couple who can't agree on how to parent their kids or one who can't agree on how to spend their money?
Wow, those are so different. Kids or money, huh? Probably money. And only because in the context of a retreat, I'm not directly interfaced with the children. So there might be other dynamics involved, whereas the parents usually control the money. So then we can kind of take care of the full scope.
Yeah, it's more constrained, it's limited, so you can focus directly on them.
Right, right. But of course, we talk about parenting all the time on retreat.
All the time. Would you rather work with a spouse who avoids conflict at all costs or one who picks a fight about everything?
Again, I see both sides of that. I think the avoidance is really interesting to work with. There's often some trauma work there. There's the fight, flight, freeze, etc. There's several more responses to that too. So that avoidance piece, I think, having someone open up who's been so closed off can be a really profound experience. Right. So my intuition is pointing to that one. Although the other one too, being able to channel the emotion is also, of course, beneficial. But maybe a little bit on the first one.
Okay. Would you rather see a couple who only comes in at the point of divorce papers or one who comes in early but doesn't take the work seriously?
Oh, take the work seriously. So divorce papers and take it seriously.
Okay. Would you rather treat a couple with totally opposite sleep schedules or one where both partners struggle with chronic insomnia?
Chronic insomnia. It's really hard when couples have swing shifts and they just pass each other. That's really, really hard on relationships. And that's a tough one.
Because it takes away possible interactions, possible time with each other, right?
Yeah, and what happens is when someone is at their best, the other person's at their worst as far as regulatory skills go. So if you're both having trouble sleeping, you can often find that like, okay, we're good until like 2 p.m. and then after that, our frontal lobe crashes. Well, then let's get a lot of good work done before 2 p.m. and I can structure that more effectively for people.
Yeah, I get that. Final one. Would you rather introduce a couple to meditation together or train them on brain mapping separately?
So if I understand the question, I think training them in meditation skills would be ideal. However, I'd rather have a brain map on both of them first so I know which meditation to train them in.
Okay. That was fun. That was really interesting. Thank you. Thank you for sharing your perspective on those.
Yeah, you're welcome. So now I feel like I should have prepared a question for you. I'm like off the cuff. Can I think of a
Yeah, go for it.
I mean, one that comes to mind, and I'm trying to think of how to phrase it, but, would you rather work with two couples that have opposite sexual fetishes and desires, or a couple that has lost interest in sex?
So when you say two couples, you mean two spouses?
Yeah,
Or
sorry. Would you rather work, a couple that has opposite turn-ons, opposite desires? One of them is traditional and one of them wants to get dressed up like a furry and go wild or whatever. Or a couple that has just lost total interest in the whole act itself.
the first one, because if they've completely lost interest, my guess is, again, they've gone through so much that they're not even willing to try anymore. But if they have very different fetishes, at least we can work on trying to see how we can kind of creatively integrate them. But if there is no interest at all, then it's like you have to work on trying to go back and see what pains have really happened to restart the entire thing.
Yeah, I think the first one probably is easier to some extent, right?
Yeah.
I will say, though, there's something when I work with couples where they haven't had sex for 10, 15 years, and then I can tell during the retreat, they come in holding hands and they're all like, cutesy, and I'm like, oh, you guys had a night, didn't you?
The vibes only a therapist can pick up.
Yeah. No, I think anyone would pick that up.
Okay. It's that obvious.
I have caught people making out in the waiting room before, and I just slowly back away to give them their time.
Okay. That's interesting. That's really interesting. Any really hilarious experiences that you've had?
Oh, yeah, so many. You want like tragic, hilarious? Do you want, just really funny, eye-opening? Like what are you
We
looking
can take the spectrum.
Yeah. I remember working with this couple several years ago now. This was right at the beginning of the pandemic, I think. And he was accused of being a sexaholic. He was accused of having affairs. And more specifically, his wife caught him going to orgies.
Oh, wow. Okay.
And so when we started the session, I got their histories and all these things. And, sex addiction is one of those very controversial terms. And maybe we can get into that if you want to go that direction. But the point of the story is at some point I said, have you ever invited your wife to go to an orgy? And this was in front of her. And he was like, what? Like it blew his mind that was even a thing that you could do. And so I turned to her and I said, what if he asked you? What would your response be? Whether it's yes or no, like what would you feel? And her response was, I would feel closer to him. And I would consider going. I don't know that I would sleep with people there, but I'm curious. Like I would want to kind of check it out and see what it's like.
Wow.
And he looked at me and he's like, I don't think we need another days of the retreat. Like, this is all I ever wanted,
That's crazy.
I think those are the kinds of stories that really strike me, that we are often so embarrassed by sexual desires and interests. And there's another one that comes to mind about, this couple where the guy signed up for OnlyFans and he was getting all these like sexy photos and things. I've actually had a number of spouses that this is the case. And I asked the same question. Have you ever asked your wife for a sexy photo? And people are like, well, no, she's not going to do that. And the wife is like, if you want a photo of me and you're going to go then like, masturbate or do your thing. And like, I'm okay with that, then we talk about privacy and how you make sure it doesn't get out into the, online and all that.
Yeah,
but
of course, yeah.
It's amazing when just having these conversations in a safe way is really powerful for couples.
And what strikes really, I'm really intrigued by this, is so much of what happens is built in our heads, that they haven't had a chance to speak to anyone about all these things in their heads. And so now it's like a belief, okay, that's not even possible. How what do you mean by that? And I think that just creates a whole different problem because they never even thought they could speak about it.
Well, there's also a lot of assumptions that are made. So there's this great, another movie reference here. I think it was Analyze This with De Niro and Billy Crystal. Robert De Niro and Billy Crystal. There's a scene where he's at the bar and he's looking at a prostitute and he says, oh, I'm thinking about going to her, and he's going to get a blowjob, I think. And Crystal says something like, well, what about your wife? And he says, that's the mouth she kisses my kids goodnight with. I'm not going to ask her to do something like this. And actually, it's called the Madonna complex. So the Madonna complex is seeing your wife, so usually it's your wife. It's usually a chauvinist, machismo sort of deal.
Yeah.
Seeing her as like a perfect being, as pure, and so you don't want to hurt her. You don't want to defile her. And in reality, a lot of people are kinkier than you give them credit for.
Absolutely. Have you had do you specifically work with heterosexual couples, or do you work with non-heterosexual couples as well?
Yeah, I'll work with anyone that comes into the office. Again, the marriage is my client, the process
relation.
them. I will say that most of the couples I see are heterosexual, but I do work with, gay, bi, and trans couples as well. And actually, non-monogamy is getting really popular too, as kind of a subset of that area.
I've been seeing that grow. Yeah.
Yeah.
Do you find things are there things that you find different when you're working with gays, bisexual couples versus heterosexual? Yeah,
so I think the best example of this is working with trans couples, or where one partner is trans. And I don't know all of the lingo and culture, and I'll be very honest about that when people contact me.
Yeah.
But what I say is that my job is to be an expert on your relationship. And whatever you are as your identity, there are some fundamental needs a relationship has in order to survive. And I think one of the issues couples therapists get into is they try to become an expert on the couple, where that's not really their job necessarily. Their job is to be an expert on their relationship and the dynamics between the two of them. And it's one of the reasons that my intake process is relatively quick. And a lot of couples therapy, the intake is like 3 or 4 hours, which feels to me to be very unnecessary, because it's the dynamic that we're trying to fix here. I'm not going to change your identity. That's not the point of the therapy. We're trying to fix the relationship.
Got it. Would you, if you could just try to debunk one myth that couples have, what would that be?
Oh, the one that drives me crazy, and if there were ever a genetic link for pet peeves, I got this from my dad, I would say, is when spouses say, well, you can't change the other person. And that drives me freaking nuts, because first of all, if you can't change someone, why does therapy exist in the first place?
Right.
And second of all, couples change each other all the time.
All the time.
All different reasons, right?
Yeah.
Your biochemistry changes. Your perspective on parenting changes. Your perspective on life changes. You are supposed to change each other. Ideally, it should be for the better. And oftentimes it's for the worse.
Yeah. Yeah. Everyone's changing all the time. So the statement that change is not possible seems ridiculous to me.
I agree.
How do you use brain maps in couple therapy?
So I find that there's a feeling oftentimes that couples think they're incompatible with each other. They're like, we're butting heads, literally, that's the feeling, And what I like to use brain maps for is to show them that there's a way the puzzle piece fits together, and there's a way that it kind of does knock off each other. And when you understand the underlying neurology, there's a different appreciation and a different kind of empathy. If you invite your friend in a wheelchair to play basketball, there's things they're not going to be able to do. And we accept it, right?
Yeah.
But that sort of predicament is obvious. You can see it, right? You know it.
Yeah.
What's going on in someone's brain is sneaky. It's not as obvious necessarily. So a couple examples of this would be There's an area of your brain called Wernicke's area, which processes language, and it creates language comprehension, both auditory and written. And if that area is not functioning the way that it should, it can look like ADHD, it can look like a kind of spaciness, it can look like inattention, but really what's going on is the person's not processing language at a kind of real-time rate, if you will. Yeah. And so sometimes I'll have couples where one person says, well, they just don't listen to me, which implies a sense of intention there.
Yeah.
And when you do the brain map, you realize, like, actually, they're probably trying harder than you think and harder than anyone else to listen to you. They physically can't. And so, especially if one person has a fast processing speed, so they're providing a lot of info as they're speaking, and the other person is trying their best to process, but they can't, there's that feeling of you just don't listen.
Right.
And so when you show them on the screen that actually there's an issue here that neither of you have control over, it's just the way it is. Now, you can go do treatment, you can work on it, but as of right now, this is just the facts. It provides a different level of empathy and understanding of the situation. Because again, it feels personal. You don't listen. As opposed to you're trying and struggling. It's a very different paradigm. Yeah. So that's one example. There's a lot of examples of where the underlying neurology plays into the relationship, but that's a common one that I've seen.
When you were mentioning this, I was thinking about something I hear about a lot. A lot. I mean, I can't imagine the number of wives who have heard say that their husbands are forgetful. They cannot pay attention to what they're saying, and they just don't listen. Is there some physical aspect to this from your research, or is this just cultural and it has just been bad habits that have been pushed into men?
So it can be a lot of different factors.
Okay.
I think sometimes historically, stereotypically, men are listening to fix. And so when they're told, I don't want you to fix, then they can tune out because they don't know what to do. Like if you're talking to me and I'm not supposed to fix anything, could you talk to the lamp? Like, I don't understand what my role is here then, you know? Yeah. And so sometimes it's more behavioral and conceptual in the space, in the relationship. If it's neurological, there can be a lot of different reasons for that. You know, so if you have temporal slowing, you could have working memory issues where like you're trying to pay attention once again, but you're just not putting the pieces together. It could be inattention, sleep deprivation. It could be exhaustion. You know, a lot of couples will try at the end of the day to have a meaningful conversation with each other, and their partner is just totally spent. But then they feel trapped, you know? On the one hand, I tell you that I don't have the energy for this conversation, which feels dismissive. On the other hand, I try my best, but I'm pretty sure I'm going to fail. And it feels like a lose-lose.
Yeah.
So I think there's lots of pieces. And then, of course, the other one here is, are you as the speaker constructing your communication in a way that can be heard? Right? So if I start with, God, you're such an idiot, I need to tell you what you did wrong yesterday, who would want to listen to that? Right? So there's some ownership over the speaker to make sure that the listener is invited into the conversation so they can be heard.
Wow, fascinating. Have you had, what's your experience been working with one spouse who has ADHD? Specifically, I want to understand the man, if they have ADHD and the wife doesn't. How does the interaction get impacted and how can they work on that?
Yeah, so first I will say, and this could get me in a little bit of trouble here, that I have a lot of issues with the ADHD diagnosis in general. Okay. I find that oftentimes it is auditory processing, it's sleep deprivation, it's a TBI. So I think it gets misdiagnosed a lot, and it's something to pay very close attention to.
Wow. Okay.
Well, let's just take for the moment that somebody has authentic ADHD, frontal lobe, theta beta ratios off, they're inattentive, they're daydreamy, they can't focus. and their other partner is quote unquote normal functioning in that sense, right?
Right. Yeah.
So sometimes we call this a neurodiverse couple, where
Yeah.
there's
Yeah.
that issue and the other person is typical.
We can use that term if that's better. Yeah.
Sure. So there's a lot of strategies to use here. People with ADHD sometimes struggle with the amount of information that they're given and expected to respond to. So being more concise and short and pausing more regularly so the other person can then, respond appropriately to smaller bite-sized pieces is helpful. There's also a level of kind of setting up for success. So if you know your partner is ADHD and you're asking them to plan a whole vacation and then they fail, I mean, you kind of knew that was going to happen then, right? Like, there's a level of sabotage and setting yourself up and setting traps that, like, it's just not fair at that point. So if, maybe in that case, if you want to plan a vacation, you say, hey, come look at these 5 resorts. I pulled them up on the screen. Tell me which one you're drawn to, or which 2. So you can involve them in the discussion, but in a way that sets you both up for a successful outcome. And then the other part of it is that, there's some research on ADHD, people with ADHD having aggressive responses, right? That they're quick to anger, they're impulsive, they say something that's mean. And again, I would look at the dynamic in that case. So I've seen this so many times with couples where they say, well, my partner has anger issues. And I take it at face value in the beginning usually. Oftentimes what I find though is that there's a provocation that then elicits an angry response. Right. And this is where both partners are responsible for their marital dynamic. Yes, it's not nice to say F you if your partner says something, no matter what it is for the most part.
Right.
And at the same time, how are you constructing your expression, and how could you do so in a way your partner could actually hear the intended message?
Okay. Thank you for sharing that. So before we close this podcast, where can people find more information about you, and what resources would you like to share with them? Yeah,
so if you go to marriagequest.org, you'll find information on the marriage retreats. As I mentioned, it's usually a 2 to 4 day program. And just so people are prepared, a marriage retreat is an investment in your relationship. This is not a copay of therapy. Like, this is something to be taken seriously. And I typically work with couples on the edge of divorce, and that there's really high stakes for what they're, coming to see me for. So what I would say is, if you read through the website and you feel like, this feels like something that would be helpful right now, then reach out. I always offer a free consultation for you to get an understanding of my style, for me to learn more about your situation, make sure we're the right fit. And if you feel like I really like the info, but I'm not in crisis at the moment, first of all, I would say, well, a 2-day retreat for prevention might be well worth the investment. But if that's not, in the cards for you right now or not of interest, check out the blog. There's a lot of free resources. We write about all kinds of topics in our blog, and, there's sex therapy. There's, if you're considering divorce, there's midlife crisis. There's a resentment that's built up. There's a lot of good info there that you can just get for free.
Thank you. Thank you so much. So here's my final question. Among the people who you saw having success rates from your retreat, what were 3 habits they learned and sustained after they moved from or proceeded from your retreat?
So one I would say is perspective. That a lot of people come in with, okay, you're hurting me, right? And when you understand that you are both responsible for nourishing the marriage and nurturing the marriage, and that chances are you've both contributed to the stress in the marriage in different ways, in different amounts at different times probably, there's a shift in perspective of, okay, I've been blaming you for the last 5-10 years, but now I realize that there's some role that I play too. And I have agency then to fix it, because you can control your behavior much easier than your partner's. So that perspective and empathy I find is really, profound. I would also say that couples get in touch with what actually connected them in the first place. You know, most couples are very coupled centered early in the relationship. They spend a lot of time together, they're playful, they have fun, and then later they wonder why their marriage isn't going well, and they're not doing any of those things. They've stopped going on dates. They you know, the kids take precedent over everything else. Their careers take precedent over everything else. So coming back to being coupled centered is really profound. And then the last one I would say is the trauma and the history, that most of what couples are fighting about isn't what it appears at the surface. And that if you can actually drill down to what's really going on and you can fix it at that root level, then it's another way to turn stress into intimacy, because you're understanding your partner at great depth, whereas the fight was superficial.
Thank you, Sho. Thank you so much for sharing your wisdom today, and a lot of valuable insights. And I've got to learn so much from you. Thank you so much, and I'm sure the audience will love this episode.
Thank you for the invitation, AJ. And everything from the pre-interview to having this conversation the last hour has been amazing. And I hope people are taking away, I guess if I can say in closing, I hope that people understand there is hope, because no one is ever taught how to be married, as you started this whole conversation with. And I think that just like you go to school to learn to become a surgeon, or you get training to be a carpenter, like the reason marriages fail is no one is taught how to do it. And it's such a shame. So I hope people are feeling that there is hope if you can just get the information and the training and the support that they need.
Thank you so much. This was awesome.
Thanks, AJ.